Welcome to Mental Health Mini number 36 on generalized anxiety disorder. The basics of anxiety starts with looking at what stress is versus anxiety. So, stress is an external pressure or threat to our own security that either motivates us to do something to reduce that threat or motivates us to avoid something that could result in harm. Anxiety, however, is the emotional response that we experience to stressors. So, stress is the actual pressure, whereas anxiety is our response to it. Anxiety can either be protective, similar to stress, or it can be out of proportion when we would call it um, dysfunctional. There's a couple of theories as to how anxiety develops. Part of it is believed that there's dysfunction in the amygdala, the hippocampus, the locus coeruleus, the brainstem, the hypothalamus, the frontal cortex, the thalamus, and the basal ganglia. As far as neurotransmitters that are involved, GABA is considered to be the primary neurotransmitter with possible dysfunction of serotonin as well. Risk factors for developing dysfunctional anxiety includes having a family history, comorbid depression, trauma, negative life events, or substance use. Anxiety is the most common psychiatric disorder, and different anxiety related disorders include generalized anxiety disorder, which we're talking about now, phobias, OCD, panic disorder, social anxiety, and trauma related disorders. The symptoms of generalized anxiety disorder, according to the DSM 5, is persistent and excessive worry beyond realistic response for a situation. The individual will experience increased muscle tone or tension, restlessness, agitation, decreased focus, changes in vital signs such as increased blood pressure, heart rate, and respirations, possible disorganized thinking, oftentimes all or nothing thinking, catastrophic thinking, or perseveration. They may experience insomnia, decreased appetite, nausea, and vomiting. The different scales that we use to assess for anxiety and measure any improvement in anxiety is the self rated scale. So, asking a patient on a scale of 0 to 10, how would you rate your anxiety right now? There's the Beck Anxiety Inventory, the Zung Self Rated Anxiety Scale, and the Hamilton Anxiety Rating Scale. Typically, when we're treating anxiety, we focus on non pharmacological treatments first, such as diet, exercise, and sleep. If that's ineffective, we can give our patients different ways to help calm them down when experiencing severe anxiety. This could be things like deep breathing, guided imagery. With guided imagery, we would guide them through a calming situation and have them focus on the senses they're experiencing as they hear the different imaging. We can do systematic desensitization, where we have the patient identify a couple of different things that cause them anxiety. And then we expose them, have them rate it to least anxiety causing to most anxiety causing. And we can have them exposed to the least anxiety causing thing that they identified and have them work through any coping skills as they're exposed to it until it gets to the point where that particular thing that they identified no longer causes them anxiety. And then you move on to the next thing, and then so on and so forth until we've identified the most anxiety provoking situation, we've exposed them to it and caused desensitization of any symptoms. We can also do cognitive behavioral therapy. As far as medications go, our first line therapy for generalized anxiety disorder would be an SSRI or an SNRI, the same medications that we use for depression. Buspar is not an antidepressant, but it is an anti-anxiety medication that we can use. It's typically most effective if they have not had any other medications before. And then we can also provide beta blockers. Beta blockers are effective in treating generalized anxiety disorder because it helps lower the heart rate. And part of the experience of anxiety is experiencing increased heart rate, which oftentimes makes people feel more anxious. Our nursing problems often associated with anxiety is ineffective coping, powerlessness, social isolation, fear, and disturbed thought process. After treatment, we would evaluate the patient by looking to see if they've had improved coping, reduced anxiety, improved social interactions and social isolate or social less social isolation, and if they've had improved thought process. And that wraps up our mental health mini on generalized anxiety disorder.